Psychedelic drugs, they are gaining some more acceptance out there. Yeah, so it's kind of an interesting concept. It started kind of in Australia. Now it's here in the U.S. Some groups are using them to help PTSD victims, along with veterans and those who may have depression. There's a therapy group that's outlining these professional guidelines for using these drugs that most people know as Molly, ecstasy, those types of things. So we've got Maya Goldman with Axios joining us live to break down what we need to know here. So what are they saying about why and how this all works?
Hi, thank you for having me. So these are the first set of professional guidelines for psychedelic-assisted therapy practitioners, and that means that they just sort of outline how this therapy should be provided and some best practices for this. So they're pretty general. You know, you might think of as common sense things like you should have an up-to-date credential and you should build trust with your patient and you should practice active consent. But they are really sort of a new legitimizing tool to bring structure to this growing field.
And how does this differ from other treatments for things like PTSD and depression?
Yeah, well, this is a new and burgeoning treatment that, you know, is still in clinical trials, so it remains to be seen how effective it is, but early signs from my research, my reporting show that they are very promising in treating, you know, things like treatment-resistant depression. So maybe if other pharmaceuticals don't work for you, this is another thing that you can try.
Maya, I know, you know, especially when it comes to PTSD and our veterans, there's been a lot of research in the past that weed, marijuana has worked, but what are the concerns from those who may be opposed to this being Molly and ecstasy, that more of a psychedelic actual drug?
Yeah, you know, I haven't done much looking into that specific dichotomy, but my coworkers at Axios have done some really great reporting on how there's not as much backlash to using psychedelics as therapy as there is for marijuana, and that just stems from how these two different classes of drugs have been viewed by the public over the last, you know, couple decades.
That's interesting.
Got you. Okay. What's next in this possibly gaining traction? What's the next thing?
Yeah, well, the American Psychedelic Practitioners Association, which is the group that put these guidelines forward, they also want to create things like a code of ethics and some kind of accreditation system for practitioners, clinical practice guidelines. So they're doing a lot of work, and then they're also waiting for possible FDA approval of some medications. And we're also seeing, in lots of different states across the country, movement towards decriminalization and legalization of these drugs.
Beautiful. Good to know.
Interesting
Good
concept.
to know.
We'll see how that all plays out.
Our people with PTSD need everything that they possibly can. They wouldn't fought for this country. Help them out. Yeah. And if it's Molly, so be it.
Maya Goldman there with Axios. Appreciate her joining us as well. So yeah, we'll wait and see. Like she said, there's still some regulations that need to move forward with that. But we'll be right back.
And FDA approved decriminalization and accreditation and a rule of guidelines, ethics, a code of conduct, and all that other stuff. We'll be right back, everybody.